I'm here to talk about DRIPP, which is the device-related infection prevention practices. And so, as already mentioned, I work as an independent nurse consultant, so just my disclosures that I have received payments from a number of companies as listed, but I'm here in a voluntary capacity as part of the IPS today and receive no payment for this presentation. So, improving device-related infection prevention practices. Those people that know Yvonne Curran, it's credit to her that this acronym was developed and we produced the DRIPP Collaborative. So why was it important? So as the IPS, we were very aware of the device-related infections. So it's estimated that probably about 25% of healthcare-associated infections are related to devices. We know that patients with urinary catheters are more likely to develop infections. We know that those with vascular access devices may result in bloodstream infections. So I think it's fair to say that we need to do something different and we need to improve the practice. We know that the guidance around infection prevention can vary and how it's interpreted from national guidance. We know that there is poor practice that does occur out there, but we knew as the IPS that we actually couldn't do this alone, that we actually needed to work with other experts around urinary catheters, continence, vascular access. So the collaboration round for DRIPP started in 2018. And actually the societies we work with is the Association for Continence Advisors, there is the the ASAP team, there's BORN, which is the Urology Nurses Society, NEVAS, which is the National Infusion and Vascular Access Society, as well as IPS, and we're supported by BD. So that in that first workshop, we invited frontline staff, specialists, clinical educators to come together and really discuss some of those problems. What were the key challenges out there? What was affecting practices? And what were the gaps in managing vascular access and urinary catheters? And what we came up with was that variation and inconsistencies around training, around competencies, documentation, and I think we all sort of cringe when we think documentation because we know there's vast gaps in what is documented. I'm not sure electronic patient records has helped us. It was my sort of vision that that would help us, but I think it has created some more challenges there. Surveillance, because we know that surveillance around urinary catheters particularly is very inconsistent, and around vascular access devices, particularly around cannulas, there's very little surveillance. There was inconsistencies around aseptic technique and how people interpreted it, and dare even mention the usage of gloves and when you put on the gloves, when you take the gloves off, and missed opportunities for hand hygiene. And then there's the care and maintenance of these devices. So we looked at producing some resources. So we didn't want to recreate national guidelines, but what we wanted to do was produce resources that were perhaps visual, practical, that would help and enable people to improve their practice. So around the vascular access devices, we prioritised a vascular access device pathway. I'll go into these in a little bit more detail in a minute. The VAD care bundles, guidance for VAD bacteremia surveillance. We've also done a complication guide. So in the urinary catheter resources, we prioritised a urinary catheter quick reference guide. Now, I've no idea why there are two groups decided we'd have a quick reference guide in one and a pathway in the other, because to me they're very similar, but that's the way we chose it. We've got guidance around alternatives to urinary catheters and discharge pathway. And we know that urinary catheters, long-term catheters, they nearly always start their journey in acute care, and we know that some of those are not necessary. We wanted to develop the resources using best available practice. So we didn't want to change that national guidance, but what we wanted to do was make it in an easy format, and we also use our expert consensus, and that's why we really needed those experts from urology, from continence, from vascular access. So how are we getting along? So the draft resource is shared for consultation via the website and virtual meetings. So we had a virtual workshop held in July last year. So we had around 120 people came to a virtual, they stayed at home, but it was a virtual workshop. It did have its challenges, being a virtual workshop, and I know there's people in the audience here that actually tried to, did a sterling job at running small workshops. So what we did was, it was all done on Teams, so we had some people moved into smaller groups, and I think it did have its challenges because people sort of got lost in which room they were going into, virtual room, and then getting back to the main room, and then trying to generate that conversation virtually. I'm going to mention Rose Maguire, because I know her group was absolutely spot on, because she said they weren't going to stay quiet. I was going to make them talk. So thank you, Rose. So from that workshop, we got lots of ideas of how we can progress, how we can take things forward, and looking at the resources that we've already created. We've had some early discussions around an app for Corti, which I think will be really beneficial if we have something in an app format. And we're also looking at VAD surveillance as well. And then I think what's been really huge and really beneficial is NHS England have agreed to co-badge our finalised resources, which is really, really good, because as you trying to use them in your organisations, it gives it much more credibility. Even though we're all evidence-based, and even though there's some really good societies underpinning the work, to have that NHSE badging on is been great. So going through the resources, and I have to say the IPS, we have got a stand. Our stand box only just arrived late this afternoon, so we have set it up, but we have got the resources. We have got this quick reference guide on the IPS stand, so please go and see us and grab one of these. So the quick reference guide it's in very visual. It's got five clear areas, so it's looking at urinary catheter assessment. What assessment do we need? It looks at the best practice round insertion, that daily care, the review and removal, the patient transfer and discharge. And I think that's really important when we know that some catheters put in the acute care end up as long-term catheter and not necessarily needed. And we make sure that we have referenced both national and international guidelines. And on each of the posters, you can see in the bottom corner, the bottom left-hand corner, we've got a QR code, and that QR code then can actually take people to the DRIPP website for further information. So we've got a urinary catheter discharge pathway. Although this looks a little bit fussy, we try to put it onto 2 pages, but it's really important we have things on just 1 page, because I think people can go back to policies and see lots of information in the policies, but what we wanted was something that was just 1 page for the guidance. So we've got a small set of evidence-based practice statements. It reflects some of the terminology that we've got in the quick reference guide for urinary catheters, so we've got that consistency. We've tested this as part of the implementation work, and it's currently on the website for consultation. My very last slide will have a QR code which will take you to the DRIPP website. And then the final resource for urinary catheters that we have at the moment is we're working on the alternatives for urinary catheters. So it's intended to provide information about the alternatives, different devices that may be available. And what we want to do is perhaps take people away from that default process of going straight for an indwelling catheter. And we know there's some really good evidence out there that patients with acute retention can often be managed by an intermittent catheterisation regime, not necessarily self-catheterisation if that's not appropriate, but definitely that intermittent catheterisation, particularly for post-operative retention. And urinary catheters will still be required in some cases, and we know that. So it's not intended to replace where there's a definite need for an indwelling urinary catheter. So moving on then for the vascular access device pathway. So we called it, I say we because I sort of part of the IV group. We decided we'd call it a pathway, but to me it's got lots of similarities to the quick reference guide. So again, it's got sections, so we've got 6 sections to the VAD pathway. So we've got that very clear VAD assessment, is it needed? Have we done that assessment? What is the good practice around insertion? The administration of medicines, the ongoing maintenance, daily assessment and removal. Again, we've used the evidence-based statements and we've referenced it with both the national and international guidelines. And again, we've got that QR code. So again, it's supposed to be very visual. It can be used as a poster. Again, this is on the IPS stand. Please go and visit. There's pens and post-its there as well. Okay, so the revision of the VAD high-impact interventions and the care bundles. So we liaised initially with NHS Improvement, which obviously now is part of NHS England, to check that we had permission to revise and update. So with the peripheral venous, the IV, so the cannulas, there was a really good paper by Gillian Ray Burrell that had already done that evidence base, looking at what should be in a care bundle. So we had some of our work done there, which made it a little bit easier. Again, we've used a small set of evidence-based statements. We've matched them across into the VAD pathway. And we're currently in discussions with NHS England now with regard to the co-badging and actually whether there's the possibility of replacing the existing ones. So that's still under negotiation. And these are on the website, still under consultation. And then moving on to the surveillance guidelines. So this is not intended to replace where there's already existing national guidelines for surveillance. So in terms of intensive care, critical care units, that there currently is a framework around surveillance. So this was intended to be something simple that a ward manager, an IV nurse or an infection control team could actually pick up the document and do surveillance either at a ward or department level, in a speciality or even across a whole trust. We've got a standardised criteria for the VAD-related bloodstream infection. So there's a checklist, and that checklist now has moved from a Word document onto an Excel worksheet. So it calculates, gives you a score, so it indicates where you've got an infection. So it's got sample templates for giving back feedback, because it's one thing collecting the data, but what we want is meaningful feedback that can be given back to departments or trust boards or even just at local ward level. And we've used the standardised VAD definitions that were developed by the Avatar group from Griffin University. Those of you who don't know, that's an Australian university that does a lot of evidence-based stuff around vascular access. So we've used their definitions. We've been working on a complications guide, which goes through all the different complications for both central lines and peripheral lines. So it looks at what are the causes, how can we prevent them, and looks at the management. And it will link with the low SIPs as well. So we're hoping that will be ready shortly and available on the website. So feedback from the July 2022 workshop. I do acknowledge it was virtual. It did make some difficulties. Some of the feedback was sort of that frustration that we weren't sat in the same room, because I think the discussions would have been richer. But other than that, the feedback was really positive. We had some really good comments, so I'm just going to read some of these out. So the surveillance tool, easy to use, that's what it was intended to be. It's been trialled now in about 10 different organisations. The VAD complication guide, it was very, very rough when we shared it at the workshop. But what they said was because it was evidence-based, it would make escalation easier. So it empowered nurses to escalate. The VAD poster can be used as an educational tool for new starters. That came through in lots of the different workshop groups, virtual rooms that we had. The guidance was uniformed. It was the one-page poster. So we all know what it's like when you've got a 10-page or 20-page policy. It's really difficult for people to read that. And I was sat in on the speaker, an earlier speaker was talking about he hadn't read any of the infection control policies till COVID came along, and then he quickly had a read of them. You know, and that sort of sums it up. When we're busy, most people out there have not read the policies. And again, the complication guide will help to empower ward-based nurses. And I think that empowerment of staff to escalate has come out sort of in a few of the discussions. We got some great ideas from that workshop as well. There were suggestions to gather case studies, patient stories and experiences. So what I'm going to ask of you is you take one of the posters away from the IPS stand and it works really well for you. Let us know on the DRIPP website. You can communicate on there. Let us know how you're getting on, because it would be really good to get that feedback. What difference has it made? Has it helped new starters? Has it been helpful in escalation? What difference has it made? Development of electronic systems and apps, so we're on with that one. We're looking at videos and podcasts, particularly some videos to put onto the DRIPP website. So quick sort of 2 or 3 minutes explaining how you can use the resources. To provide shared learning forum and network opportunities. Webinars to spread the use of resources, so we're planning some webinars, particularly in the autumn, on how to use those resources. And educational practical training on ANTT and the picture guides. So what next? Am I right for time? I was looking for an amber light. It hasn't shone up yet. Okay. So what next is, how can the resources be shared? So we're looking at those different ways. So we're looking at the webinars, we're looking at the videos, we're looking at opportunities like this where we can spread the message. And what is needed to support the implementation? So we're planning 2 more workshops. We're going to divide them into urinary catheter and IV, and I'll give you a little bit of an update of that in a minute and those dates to put in your diary. Where we can really look at what is that support to implement the resources. I've already mentioned about the development of case studies to share practice. You could be part of that. Just pick up the poster and let me know how you get on. And how will we know if an improvement's been made? So I think it's really important that we can produce resources, but actually what we want to really know is what difference is this making? Because ultimately we want to reduce down that burden of healthcare associated infections. So here we've got the whole of the dates. So the 26th of June and the 19th of September. So on the 16th of June, it'll be for the urinary catheter workshop. And on the 19th of September, it's for the vascular access device workshop. We wanted to put them both together, but actually it's probably not practical, because there will be some people that just want more focus around urinary catheters, particularly our member societies around continence and urology. They don't particularly want to know about IV. Equally, IV people don't particularly want to know about urinary catheters. But infection prevention people do usually want to know about both. So you're entitled to come to both. It will be at the BD head office in Winnersh in Reading. So the objective of the workshop is to really launch our DRIPP resources and give that overview of how they've been developed. And to provide the feedback from the workshop that we held last year and share those case studies where we're looking out there for for those case studies where we can really feed back how they've been used and what difference has that made. And really have some round table discussions. And this is more about developing those networks. So actually you've got that network of people. And I have to say, when I first started infection control and as a single-handed infection control nurse in an organisation, without networks, it was, you know, they became really important. And I think equally with DRIPP, it's really good to develop those networks. I mean, networks will be easier now because we can use WhatsApp, we can use email, we can use websites, not back in the old days where, you know, it was a phone call or writing a letter in the day. And then we're going to focus the afternoon of these workshops very much on a very practical quality improvement. So to look at, we've got a facilitator that's coming that's very experienced around quality improvement. So really help people to take away a resource and actually put that into practice in their workplace. So I'd like to acknowledge all the members of the DRIPP urinary catheter and the IV group, and I know there's quite a few people that are here today, so thank you. So the Infection Prevention Society, British Association of Urology Nurses, the Association of, I think it's for Continence Advisors, I think I've got a spelling error there, the National Infusion and Vascular Access Society, and the Association for Safe Aseptic Practice. And finally, the DRIPP Collaborative are very grateful for the support that has been provided by BD. So they've funded the website. It's an independent website. It's not a BD website. So they've funded it and developed it, but it's independent. The organisation of the webinars and the workshops, they've printed the resources, which we're grateful for, but they've had no commercial input into the development of any of the resources. They're just there to support us. So as promised, there's the DRIPP website. If you get your phones up, that QR code will take you to the DRIPP website where we've got all our resources. So we've got the Meet the Team, we've got the resources, we've got the events that are coming up, and we've linked it to any other resources out there. So we're not trying to duplicate resources already there. So for vascular access, the vessel health and preservation documentation or links to the website for VHP. There's the links to the Capital Nurse that have developed the competencies and training framework for vascular access. We've got the I Decided tool, which is an Australian tool to prompt early removal of vascular access devices. And equally for the urinary catheter, we've got the link to the University of West London and their iHydrate resources. So that's me. Thank you for listening.